Hello, welcome to Boresha Jamii TV, a channel that brings you stories, knowledge, and conversations that lead to stronger and healthier communities. I am your host, Joyce Komboka. Today, you're going to focus on a topic that is very important, that is comprehensive HIV care. HIV prevention and treatment is not just about medicine. It involves biomedical, behavioral, structural, and community interventions that work together to protect individuals, to support people living with HIV, and reduce new infections. We will begin with the biomedical components. These are medical and clinical interventions that directly reduce HIV transmission or improve health. Key biomedical strategies. They involve HIV testing and counseling. Early testing allows timely treatment. There is ART or antiretroviral therapy. This helps in viral suppression, enabling people living with HIV to live long and healthy lives. When the virus is undetectable, it is also untransmittable. The other is pre-exposure prophylaxis or PrEP. This is for HIV negative people at higher risk. There is PEP or post-exposure prophylaxis. This is emergency medication after possible exposure, which is taken within 72 hours. The others are condoms and lubricants. These are effective barrier protection. We also have PMTCT or prevention of mother-to-child transmission. This is ART for mothers and follow-up care for babies. The other is safe male circumcision. This reduces HIV acquisition risk in men. There is also screening and treatment of STIs. Since untreated STIs increase HIV transmission, screening is very, very necessary. Biomedical tools work best when combined with supportive behaviors and a strong community environment. We move to behavioral components. These are actions individuals take to reduce their own risk and promote healthy living. Key behavioral strategies involve correct and consistent condom use, regular HIV testing and knowing your partner's status, adherence to ART and PrEP medication, reducing risky sexual behaviors, avoiding multiple concurrent partners, alcohol and drug moderation, since intoxication reduces decision making. Partner communication skills. Open conversation about health, protection, and testing. Stigma-free interactions. Supporting loved ones living with HIV. Why behavior matters. Even the best medical interventions fail if behavior does not support them. We move to structural components. These are systems, policies, and socio-economic factors that influence HIV risk. Important structural interventions include strengthening health systems for easy access to testing and treatment, policies that protect against discrimination in schools, workplaces, and communities, economic empowerment programs, especially for the youth and for women, improving access to education, creating safe environments for key populations such as sex workers, gender equality initiatives, reducing power imbalances that put women at risk, reducing poverty, which often drives risky survival behaviors. Why structural factors matter. HIV risk is not only about personal behavior, environment shapes choices. We move to community and social components. These support people emotionally, socially, and mentally. And they include support groups for people living with HIV, where the members are able to share experiences and promote positive living. Community health volunteers who offer follow ups, peer educators, especially for the youth and for the key populations. Family and community counseling, which helps in reducing stigma. Education forums such as church groups and school programs. Nutrition support and general well being. Mental health and counseling services. A supportive community improves treatment, adherence, and reduces new infections. Comprehensive HIV care works when these components work together. Biomedical goes hand in hand with medical protection and treatment. Behavioral goes with healthy choices. Structural goes with supportive systems. And community stroke psychosocial works best with emotional and social support. This is how we reduce infections, support people living with HIV, and strengthen the fight against HIV in our communities. Comprehensive HIV care is a shared responsibility. When we combine medical interventions, positive behavior, and supportive community systems and strong policies, we build a healthier and safer society. Thank you for watching Boresha Jamii TV. I am your host, Joyce Komboka. Let's keep the conversation going and healthier. Let's build a community where everyone thrives. Thank you. Bye. Till next time.